morning, guys. Welcome to another vlog. I am going to be filming just a couple days of my life. We have clinicals. It is our adult health 2 clinicals, so I think we're in like the intermediate care unit or something, but should be exciting. First day. I'm so nervous, so I'm gonna put on some like really good music. It's so dark right now. It's 5:36 right now. I'm set to get there by 6. We have to park across the street, so I wanted to get there early so I had time to walk. But yeah, I obviously can't vlog much, but I'll give you updates if I can. But yeah, we are all set. I'm so nervous. It's fine. It's not a test. That's what Nate was telling me yesterday. He was like, bro, it's not a test. It's just clinicals. Like, you're fine. And it's the first day, so it should be pretty chill. We're just getting to know, like, the unit, the people. So, we'll see. But I'll talk to you guys later. Okay, so I'm finally here at the hospital. And I was listening to some really good music on the way here. But every time I see the nurses, especially young nurses, it just makes me more motivated, and it kind of puts me at ease because I think a lot of these nurses have been in my position not too long ago. I mean, I never want to be in the way of a nurse, and I know that's like a big thing, is like, or a big stigma is that nurses are mean to nursing students because they don't want anyone like ruining their workflow. But the last time I was at this hospital, I had a really good experience. We were like more in the peds side, but I don't know, I'm feeling good right now and a little bit more motivated, so we'll see how today goes. Guys, Nate packed me my lunch. I told him I had to wake up early, or had to stay up to make it, and he decided to make it for me. So good morning, guys. Happy 3rd shift out of 9 clinicals. It is 5:40 right now. I have to leave in like 10 minutes. If you are new to my channel, hi, my name is Amaya. I'm a nursing student in an accelerated nursing program, and we are in our critical care rotations. So ICU, ER, step down from ICU, that sort of thing. So we're gonna go get packed in the car and then hopefully get there early enough so that I could read a little, because I'm reading a book right now and I want to finish it. So let's go. We finally made it to the hospital. I think we have to be there at 6:45 and it's 6:30. I don't think I'm gonna read because I'm too anxious to do so. But yeah, I'll check in with you guys probably after my shift, and I'll just update you on how the day went, but hopefully it's a good day. I had good sleep last night, so fingers crossed it's feeling promising. Hello. So we are back from our clinical today, day 3. It was so good. What's better? And I got me pizza. So, oh, I'm gonna get a Snapple real quick. Alright, so rundown of how my day went. Started off the day with a rapid response.
Netflix, and you're gonna do this now?
Well, I just want to talk to them real quick. So we started off our day with a rapid response because we had a patient complaining of chest pain, and at the facility I'm at, when someone complains of chest pain, then you gotta just go through the motions of calling a rapid. They come in, they do their assessment, they do their EKG, and they kind of take over the patient for the morning. So that was like right after we got report. And I don't know if it's like where I was at or the nurse I was with, she's just like so calm, but I was expecting a rapid to like feel like a rapid, you know? But it was actually like super chill. There was no one running into the room with a gurney and a crash cart. Like, it was just a patient care team. They just came in, they did their assessment. It was and then the rest of the day was really chill. My nurse was super great, and she let me be involved with a lot of the patient care. She let me set up tube feedings. I did my head to toe assessment today because we have to do a pass off on our head to toe and med admin, and we can't technically pass any meds until we've done our med admin pass off. And after I did my head to toe, I was ready to do my med admin, but my professor wasn't, so I guess she was just focusing on other stuff, so I didn't get to do that today. So hopefully tomorrow I can get my med pass off and then just start working with the nurse on giving meds. But yeah, I saw a straight catheter be placed, which I didn't know. We only learned a Foley catheter, and they hadn't really talked to us about what a straight catheter entails. And so I asked the nurse who wanted to show us why you would choose a straight cath over a Foley, and it's just to kind of prevent infection. A straight cath is more temporary. It just goes in, and then once the bag fills up, then you take it out. And so that was really straightforward. I kind of wish I had done it so that I could say I had done it, because it is so much more simple than a Foley. But now that I've seen it, I know that I'll be prepared the next time a nurse comes up and asks if I want to do a straight cath insertion. So that was that day. I got to help with a midline dressing change. I got to help transport a patient who was connected to a bunch of different things, had a trach, had chest tubes, and so I got to see what that entails when we have to closely monitor a patient who's not necessarily stable, and they have to go get scans done and whatnot. So I was able to be involved with that, which was really cool. But overall, I had a really great day, and now I'm thinking it's only downhill from here. But I'm hoping that tomorrow's a good day as well, and I have a good nurse, because yeah, that honestly just makes the clinical day better. But I am going to relax now. He is waiting to watch a show. We're watching The Brother's Son on Netflix, and it's so good. Really?
It's the Soon family.
Oh. But we're watching that, so I'm gonna watch a few episodes of this, and then if I have time, maybe read. But I'm just gonna chill the rest of the night so I can sleep early and do this all again tomorrow. Morning, guys. I just wanted to do a morning check-in. I have my Red Bull this morning. I think, honestly, for me, I tend to get a lot of anxiety surrounding clinicals, and I don't think that's something that's ever gonna go away. Maybe 10 years down the line after I've done this for a while, but I just can't imagine like shaking this nervousness, I guess. But yeah, I think the car ride, and then I tend to get to the facilities normally 15 minutes early, just so that I can kind of decompress. Like, I need my space in the car so that I can listen to music, start to feel good. But yeah, this is like the worst part, because I don't know who my nurse is gonna be. I don't know what the day is gonna look like. I don't know what unit I'm going to. So I feel pretty comfortable in the CMU, but there is the possibility of going to the medical ICU or even going to the ER, which I am really excited to go to the ER, but I don't know if I want to go right now. I think it'd be nice to end clinicals on a high note, so if I can go later in the rotation, I would rather do that. But I don't know. A lot of nerves, as you can probably hear in my voice. But manifesting a really good day with a really good nurse, and everything should be a-okay. So that's what today looks like. I will check in with you guys after clinicals. clinical day 5. It is honestly going by so fast, and like I said earlier, I'm nervous again. I'm like 30 minutes early just so that I can sit with myself and try to calm these nerves down. But before I went in, I just wanted to kind of recap you on what happened on Saturday. Saturday was a really great day. I felt like I learned so much. I felt like I was a real nurse because there is one specific instance where my nurse was on lunch. I was watching over our patient. She had given a report to another nurse to kind of cover for her for the 30 minutes, but I was making my rounds, checking on all of our patients, checking their vital signs, and I noticed that my patient who had a mechanical ventilation, that his machine kept beeping and it was saying low VTE. I was like, I don't really remember what VTE is, so let me look it up. And essentially I was reading that the output, like the patient breathing back into the machine, wasn't as great. I noticed that his respirations were up to like the 40s. So I went to go find the nurse that was covering. Couldn't find her, but I found my professor. So I asked my professor to help me, and I gave her the rundown of what was going on with the patient. And I was like, I think he needs suction. And she was like nodding her head, yeah. And she's like, have you done it before? I said, no, but I've been seeing my nurses do it throughout this whole rotation. I'd like to try. And so I was able to suction, and after I had done one pass, we were looking at the patient's vital signs and we saw his respiration slowly go back to normal, which was kind of crazy to see because every time my nurses make decisions based on like their assessments, I always wonder like, man, how do they know so much? Like, how do they know what to do? And in that moment, it was like I had assessed, taken action, and then reassessed and saw better outcomes for the patient, and I was just so in awe of myself and that I had trusted my gut and trusted what I had learned in the classroom and what I had learned in this rotation that like this far. And I just thought that was a really cool experience, and it made me really excited because it was at that moment I felt like a real nurse, which it seems like a small scale suctioning, but honestly that can make the biggest difference for a patient, especially who has a hard time breathing on their own. And so I don't know, it was just a really cool experience, and I thought I'd share that before I went into today. I don't know what unit I'm going to be in today, but I don't know, I'm excited. It should be good still. Alright guys, we are back. It has been a long time since I've talked to you. I think it's been like a week, but clinicals have just kind of been crazy and my days off, I'm likely sleeping, and so I've just been really exhausted. But right now we have about three more days of clinical, 2 technically, but we have a virtual day tomorrow. So I've just been like decompressing after every shift, reading a book, which by the way I want to show you guys. I got a Kindle and I'm so excited. I was reading earlier in this vlog, you guys saw that I was reading A Little Life, which was sad. 800 pages of sadness. It was not my favorite read. It was a good read. Like, the writing was amazing and the characters were amazing, but you know, it was a sad read. If you've read it, then you know it's not going to be a favorite book on your what I've read list. So, but anyways, after I finished that book, I started reading A Fourth Wing on the Kindle, and Fourth Wing is so good. Like, that book I just haven't been able to put down. I'm already 50% into the book, and I can't tell if it's like the book itself or reading on the Kindle. Could be both, but I've been loving Fourth Wing so much. It's just like, it's kind of predictable, but there are definitely moments where I'm like, it's been so good and such a nice like break from reality. But I did get a Kindle. This is the Paperwhite 3, so it's an older version, and I got it off of this website called Unclaimed Baggage, which is a crazy website. It's basically where they sell items that people don't claim at the airport when they don't claim their luggages. And so I got this for a fraction of the price. I think normally these are like around $149, but I got this for $50, which was amazing. And then I put these cute little pink stickers and my pop socket on here so I can just read. But yeah, that's what I've been doing on my free time for the most part. But I just wanted to talk about clinicals for a little bit because it's been a really great time. So last time I talked to you guys, I was just mentioning how I was in the step down from the ICU, and I've been really liking my time there. I've been having a lot of great nurses who are letting me practice a bunch of skills, but right after that I got put in the ER, which I was terrified to be in the ER. I didn't think I was gonna like it as much as I did. Actually, no, wait. Before I went to the ER, I was in the medical ICU, which also I didn't think I was gonna like as much. But I started my day in the MICU, my first day there. I started it within 30 minutes and we had a code. And that was my first time doing CPR on a patient, doing compressions, and it was just a crazy experience. My nurse was so good. She just threw me in there. She was like, "Have you done compressions before?" And I said no. She's like, "All right, put some gloves on, like get in there, get in line to do compressions." And I was like, "Oh my gosh, this is happening." And this was a goal of mine for this clinical. Just because I feel like as a student, it's better to get some of these experiences rather than starting as a new grad and not knowing like what it feels like, not knowing how you're going to react to a situation. And so this was something that I've been wanting to do, which was like a lot to take in. Not necessarily because it was super emotional for me, but when I was in the middle of doing my compressions, there was like a split second where I was thinking, I was feeling really guilty. I was like, this is what I wanted to do. Like I wanted to do compressions, but of course you don't ever want like a patient to die. And he coded, and that was something that I have been struggling with a little bit, just because yes, I've been wanting this experience, and the only way we get these experiences are if certain things happen. But there was just a moment where I was like, I wanted to do this. Why did I want to do this? Because it's someone's life at stake. But that guilt was kind of short-lived, just because you have to focus on keeping this patient alive. You have to focus on doing your best. And so I just kept pushing through it. Compressions are really hard. I was really tired after the 2 minutes. Like I stepped down and my legs were shaking and I was just like trying to breathe, like deep breathe and like catch my breath. I have been involved in a couple more codes since then, and it definitely doesn't get any better, but it was really great to experience in the sense that like I know what that feels like now. I know that I'm not going to crumble under pressure, especially in such a high intensity situation. But yeah, that was basically my experience in the MICU. My first day, my nurse did a really great job of just like pulling me into the med room right after, and she was like, "Okay, how do you feel? Like that was your first time doing compressions. Are you okay? Like, do you need a minute?" But then she also told me, even though these codes happen, you have other patients. Like you have to move on. You have to almost have that short-term memory because you have other patients to take care of. And so I think that really helped me in like coping with the whole situation. Was like, yeah, there are other patients we need to take care of. We have to do other meds. We have to do other interventions for other patients. And so that just helped me a lot to see the bigger picture and also realize that these things happen, but you have to keep pushing forward. And I'm really glad to have learned about myself that I can move on from these situations, not in like an insensitive way, because I will probably never stop thinking about my first code, but you have to keep going and you have to keep caring for other patients, and that's just the name of the job. And it's been really interesting to kind of see what emotions that brings out of me, see how I feel about certain situations. But it was a really great learning experience, and I'm really thankful that I had a really good nurse by my side that day to help me and to continue to teach me after such a hard situation. The following day, I was put in the ER, and that was a crazy experience. I honestly didn't think I would love the ER as much as I did, just because I tend to be very timid sometimes. But in the ER, again, I had a great nurse who really pushed me into doing things, and other nurses around me were pulling me to put in straight caths or to put in OJ tubes, to be part of compressions when we had patients who were coding. So that was really helpful. One of my goals for this rotation was to start more IVs, which I've been terrified to do, and I had only ever done once before in a rotation, like back last March. My nurse let me go to the lab in the afternoon when we didn't have as much patients. Our patients weren't, asking of too much, so she took me to the lab section where all they do is start IVs, draw blood. And so she let me shadow some of the nurses there, and the nurses there were really great and really helpful, and I learned a lot about starting IVs, and I think I got in like 4 IVs. Like, they just let me practice person after person after person, which was a really great experience. So in the ER, I got to practice like a lot of physical skills rather than in the step-down ICU or the MICU. I was doing a lot of critical thinking and like going through the nursing process, and then in the ER it's just like intervention after intervention, and I'm really thankful that my nurses let me do a lot of skills and kind of check that off my list of things that I've done. So it's been a crazy, wild ride in this critical care rotation, but I'm really excited. I think I'm very interested in the ER now, which again was super surprising. Didn't think it was going to be the place for me. With that being said, that is going to be the end of today's video. I really hope you enjoyed these few clinical days of my life. It was kind of chaotic and I didn't really get to film much, obviously, because we were at the hospital, but I hope this kind of motivates anyone who's watching who's a nursing student and is feeling nervous about clinicals, or I don't know, if you're thinking about nursing school and you hear that some of these experiences are something that you would want to do. I hope this helps a lot. If you guys enjoyed today's video, make sure you like and subscribe because it would mean so much to me. But yeah, I hope this was informative in a way, and I will see you guys in the next video. Bye!